me happy. And a fella can't make me fancy. We smiling for a whole nother reason.
What's the health for a second? That's good. All right, we're talking about smartwatches. They're getting even smarter when it comes to tracking your health. Some cutting-edge technology regarding knee replacement, knee surgery, which I'd like to focus on. Dr. Jeffery DeClaire is with me. First of all, good morning. Thank you for being on the program.
Good morning. Thank you.
All right, let's talk about knee surgery. In the average world, will just about everybody need knee surgery at some point in time?
No, I wouldn't say everybody. I mean,
what percentage do you think?
You know, a high percentage. The knee is the most commonly injured joint, and it relates to cartilage. Cartilage has no blood source, so in our early days of activity or sports, we can get cartilage injury, and once that cartilage is damaged, it can evolve over time and become degenerative.
Do you get runners, a lot of runners, do you see?
You see a lot of, you know, all kinds of athletes, but yes, runners can be in that category.
What's the most common type of knee surgery?
Probably the most common knee surgery is arthroscopic surgery. That's the ability to look inside the knee with a scope to address cartilage problems early, so hopefully we can save or preserve cartilage.
Now, I understand that AI, artificial intelligence, it's making its way into your surgery?
Yes, it's been an evolution over time.
How does it work?
So what it is, and it's a combination of utilizing and really with the technique of surgery, where we're able to capture data. The data goes on a cloud database, which literally allows me as the surgeon to be able to use that data to correlate the position of the implant with patient outcomes.
While you're actually surgery, are you looking at a screen more than you're the patient?
Yes, so it's a combination of what we refer to as computer navigation combined with robotic assist. A knee replacement, a lot of people think the whole knee comes out and the whole total knee goes in, but it's really just a resurfacing of the joint. And so the position of that implant is very critical so we can have balance and stability of ligaments.
Did you also use 3D technology too?
Yes. So
what is that?
So the uniqueness of this is it's a method where using the computer, I'm able to create a 3D image of the knee, and not just the knee, but the entire leg. It's done with infrared technology. It's called morphine. So it's like a pencil with sensors on it, and those data points that are sent to the computer creates the 3D image. So it's like I can take the knee out of the body, move the knee, watching it on the computer, and then the other part is using a ligament tensor device that can measure the tension in the ligament with objective numbers within 1/2 millimeter. The ligaments are what connects the joints or bones together.
This is all done by 3D.
Yep.
I'm fascinated by this. All right, let's talk about this smart. Is that a smartwatch, doctor?
No,
that is not a
smartwatch. Not today.
That is not a smartphone, a smartwatch. Expensive one, but not a smartwatch. All right, so what's the deal? When you have after all this technology, you have a knee surgery, you recommend a smartwatch for your patients. What should they do with it?
Yeah, so with smartwatch technology, we've been able to use that, one, for communication with patients. It's connected with an app to their smartphone, and the communication part, we can talk to them with text, video, photo, real time, daily, HIPAA compliant.
Is this for a therapy, a physical therapy after surgery?
It's also used prior to surgery, so we can educate them on what to do. They're educated on the exercise program prior to surgery as well as after surgery, where they have video modules that they can actually do their therapy in their own home.
Did Apple do a study on this?
Yes, I've been involved with a study with the Apple Corporation. This started in 2018. We have almost 7,000 patients enrolled. And what we're doing is capturing the data, or what we call the metrics, which we measure step count, gait speed, flights of stairs, and stand time. And now what we are able to do is analyze that data and look at what we call recovery curves.
Wow. To
know where that patient is in that recovery.
A lot of data, numbers, great. How much of the recovery is mental?
Yeah, a very big part of it is mental.
Can you quantify that?
Not accurately, but that's the part where now with the smartwatch and the app, we create this engagement, this connection to the patient. Instead of just seeing me as the surgeon every 2 weeks or every month, we now can interact with them on a daily basis.
I just had knee surgery on Monday. What is the next day I should be up walking on it?
You'll walk on it the day of surgery.
The day of?
The day of surgery, yes. Yeah, and this gets into the methods of what we call minimally invasive process, which is, it's not so much incision length or a tiny incision, but it's how the tissues are handled. I always say the new knee goes in, it's brand new, but the ability to minimize the trauma to the tissues creates the rapid recovery.
We just put your number on the screen. We will put it on there again. Doctor, very interesting stuff. I am fascinated by this technology, AI and 3D in knee surgery, probably other surgeries too, I would imagine.
Yes.
Thank you for being here. I appreciate that.
I appreciate it. Thank you
Good.
very much.
Quick break. We'll be back in a moment.